So I've packaged the course into 5 easy, accessible modules, and I'll just talk you through them quickly now. So module 1 is all about the preparation. So it's all the different ways to help you get ready to make the process really, really successful. And even if you've started and you're wanting to restart because it hasn't worked properly, or you feel your child is pretty much ready to go, I do still recommend that you run through the Get Ready Module 1. Module 2, it's the collaboration, working together in partnership with your child. And when you get partnership with your child on potty training and other areas of their development, you'll find that things go so much more smoothly, you get so much less resistant, and you get a motivated child. So loads of really great stuff within Module 2 on partnership. Module 3 is ready to go. It's that exciting moment when you're going to remove your child's nappies and get them dry, get them using the potty, get them doing wheeze and poos on the potty, and moving on to that next stage of independence. So it's going to be a really exciting time. And even if I say, as I said, even if you started and haven't succeeded, you'll find, because you're so much better equipped, that Module 3, ready to go, will be a different experience for you and for your child. Module 4, troubleshooting and frequently asked questions. So inevitably there may be slip-ups, there may be hiccups, and there's lots of things covered in the area of troubleshooting. Life events occur, and that can affect a child. And there's also frequently asked questions, and hopefully you'll get your question covered in there, or jump on the Facebook page and you'll get it answered there too. And Module 5, relaxation audio. I trained as a hypnotherapist some years ago, and parents really, really love my relaxation audios, and this is one of them that's very, this is designed for this program, and you'll find it really, really useful. If you're the sort of person like I am that maybe tends towards impatience and a short fuse, I absolutely can guarantee you that if you can spend 5 minutes a day listening to this audio, it will reduce your stress levels and increase your levels of patience. And on my expert interviews, so there's some great stuff there, everything to help you get this process going smoothly and successfully. So here we go, jumping straight into Module 1, Get Ready. Are you ready? So let's think about this. Are you ready and psychologically prepared? Just really worth asking yourself that. Am I in a good position? Am I in things there? Have I got so many things going on in my life that I really can't focus on my child? If that's the case, then I would say have a look at what you might be able to say no to, what you might be able to cut back on. So you need to be both psychologically and emotionally ready to tackle this process. You're going to be so well equipped that you're going to find it easier than you think, but nevertheless, if you're going at a crazy, crazy, crazy speed, then it may be that you're not ready to work with your child. Am I patient? Well, I think I mentioned just now, I am not the most patient of people, but I've learned to develop it. It's something that I've really had to work on as a parent. And I use the tool of the meditation relaxations myself, and I find that really, really helpful. Do I have the time? Well, we never ever have enough time in life, but I would say, can I make the time is perhaps a really good question to ask yourself. Can I work with my daycare or nursery, or perhaps you have a nanny looking after your child, and hopefully you can. So that's something that you need to be aware of. Do I have time to observe my child? So, perhaps at home, if you have a baby there or an older child and you know that you want to work with your child, maybe you need to enlist other people to help you so you can spend some time to observe your child. Am I ready to make this a calm and happy process? I hope you are. And is my child ready to potty train? So let's have a think about this. The most important thing to remember is this is about stage, not age. Please, please, please remember that children potty train at different ages. And maybe you have a friend who has a child who is under 2, maybe she's 18 months old and somehow or other she got it. And you're feeling like it's time for your child to potty train because she's the same age as your friend's child. But it is so important to know that children develop at different stages. And if you think about this, when you were watching your child learn to crawl, I suspect that your child crawled at a different age to other children's children who you know. And the same happened with walking. When your child was ready to walk, if you'd pushed it too early, you probably wouldn't have got them to walk at all. In fact, it's pretty much impossible to get a child to walk before they're ready. And whilst potty training is slightly different in that it is a little bit with the collaboration, you can encourage a child. If they're not ready, then it's just not the time to start. So, and you're going to get some ideas on all the different ways to decide whether they're ready, but this is about stage, not age. So here are some of the signals. Do they sometimes have a dry nappy? So a really good way of testing this is do what I call the kitchen paper towel test. So you're going to put a folded up piece of kitchen paper towel in your child's nappy, and after an hour to 2 hours, or an hour, hour and a half, test it. See if there's anything there. See if it's wet. Because the reason I get you to do this is that generally nappies are so absorbent that even if your child has done a small wee, you wouldn't necessarily be able to tell. So if you can tell that after an hour and a half, it's still dry, that's giving you a really good indicator that their bladder has the capacity to hold on to their wee, their urine, for that length of time. Now, I would test this over a day because you may find that at one point after half an hour it's wet, but later on in the day it's dry. So that will give you over a day or even 2 days an indication whether they can hold for that length of time. Do they have predictable bowel movements? This is absolutely not a must, but if your child, if you know that they fairly predictably have a bowel movement, a poo, perhaps after breakfast or after a meal, that's going to work in your favor, because then you can know that you will be able to introduce the potty just before that bowel movement for them to see if they can do something into the potty. They notice when they are going to do a wee. So some children will actually start to say to you, when the more interested they are in the whole process, they may start to say to you beforehand that they're going to do a wee. That doesn't mean to say you're going to leap straight in and whip the nappies off, but that is a sign that they are getting ready to potty train. They sometimes tell you that they sometimes tell you when they're going to do a poo. So sometimes might tell you beforehand that they are about to do a poo. They clutch onto their genital area or their bottom. So that is, again, is something that's showing you, and it's possibly unconscious for them at this moment, but that's showing you that they have a body awareness, that they are aware that something is coming out or has come out. They understand the difference between wet and dry, clean and dirty, and up and down. So these are going to work in your favor when you start to talk to them about whether their underwear is wet or dry. Their hands are clean and dirty, and they can pull their trousers, their pants, their underwear up and down. What other signs are there of readiness? So, ability to communicate physical needs. So this is showing you that they have a body awareness. If they are aware of hunger, they're aware of thirst, or they're aware of tiredness. Now, I know that children will rarely admit that they're tired, but there is the odd child that will tell you that they're tired, or they're certainly communicating it through rubbing their eyes. With hunger or thirst, what they'll generally do is demand something. So they'll say, they'll say, I'm hungry, or they'll say, I'm thirsty. What I'd like you to start doing with your child, and this is an area that's an overlap between potty training and general good parenting tools, is to get them to ask you to make a request. So if they say, I'm hungry, then you get them to say to you, well, what's your request? What are you asking for? and you're hoping to get them to say, please may I have some food, so, or please may I have a sandwich, or please may I have an apple. So you're going to be training them within that. And same with thirst, they'll probably tell you they're thirsty, so again you're asking them to make a request, please may I have some water, or please may I have some juice. And tiredness, they'll probably just be showing you that. So you, if they do say I'm tired, say, what's your request? Would you like to have a nap? Showing an interest in other people on the toilet. Are they curious? Are they, when you're on the toilet, or whether another child is on the toilet, are they showing an interest in what's going on? Are they showing an interest in sitting on the toilet? So I've called it the loo here. Sometimes in the UK we call the toilet the loo. So are they wanting to sit up there? Are they when you're up there, are they wanting to climb up and see what's going on? Are they wanting to wear underwear? Some children have noticed that other children wear underwear, so maybe they want to try it on, or they ask to wear underwear. It's not necessarily the sign that they're ready to go straight off, but it's showing you that there's a sign of readiness. Taking themselves off to a quiet corner before they do a poo. A lot of children like privacy when they need to go to the toilet, and particularly to do a poo. So if they are taking themselves off somewhere quietly, that's a very good indicator that they know they've got the physical sensation that it's about to come, and they've got the awareness that they want to go somewhere private to do it. Another sign of readiness, is an interesting one, is that they have general gross motor skills. And those gross motor skills might be that they can run efficiently or jump on 2 feet. So that is a sign that they're physically maybe ready for potty training. General cooperation. So one of the things that they is another good sign is that you can give them a 2-stage request that they can complete, they can follow through on. So that might be, take your cup and put it on the table. So first stage of the request is take your cup, second stage is put it on the table. Or go get your teddy and a book and we'll have a story. So teddy and book, that's the 2 stages of cooperation. And if they are able to do that, that is a sign of readiness. So what are we going to do to help get your child ready?